Hi, my name is Bing Huang, a principal scientist from BrainCheck. We are a digital health company focusing on cognitive health. It is my pleasure to present our team's project, AI-driven chatbot to navigate the cognitive care plans for persons with AD and ADRD. So in 2024, nearly 7 million Americans are living with Alzheimer's disease and related dementia, and 80% of them are receiving care at home from family members, who often undertake this responsibility without formal preparation or trainings. These 11 million family caregivers currently providing an average of 31 hours of unpaid care each week. Many of them find it very stressful. Two-thirds of them struggle to locate resource and support, and 74% of them are concerned about their own health. This in turn impacts the patients. Patients can experience worse symptoms and reduced quality of life. So there's an urgent and a critical need to providing more support and resource and to the patients and caregiver at home. I want to first talk a little bit about the BrainCheck platform. It is a digital platform designed to help healthcare providers to better screen, assess, and care for patients with cognitive issues. It has multiple tools on the market that are currently used in the clinical practice, including a quick screening testing to flag the patient who may need further testing, and a computerized cognitive battery that evaluates multiple cognitive domains to detect signs of possible cognitive impairment. And for the patients who are diagnosed with cognitive impairment, it has a digital cognitive care planning tools to help provider generate cognitive care plan. The care plan includes personalized recommendations for follow-up actions to address neuropsychiatric and neurocognitive symptoms, functional limitations, and providing care resource. Well, the provider usually walk through the care plan with the patients and the caregivers in the clinical visit. There's still lack of the ongoing support outside of the clinical settings to guide patients and caregivers how to implement the care plans, to answer questions they may have, or to provide the resource they may further need. To address this gap, in this project, we propose to develop an AI chatbot named BrainCheck Connect to provide continuous and real-time support. So we will develop a web-based chatbot that connects with the AI model in the back to allow the user to get response to their care plan-related questions in real time on any device. The AI model will leverage the large language models like Llama 3 or GPTs. We will also employ the retrieval augmented generation framework to constrain the model in a knowledge base specifically designed for the dementia cares. More importantly, the patient's profile collected during the cognitive care planning process, such as the demographics, cognitive testing result, functional status, will be integrated to generate personalized prompts for the model to produce more individualized answers. Here's our approach to develop these tools. In aim 1, we will work with the patient and caregiver who have received the care plans, and also the dementia care experts to learn the challenge or support they may need through the interviews. At the same time, and we will start to develop the large language models with or without the RAG framework and fine-tunings, so the best performing model and will be used to develop a functional prototype of BrainCheck Connect. Then in the aim 3, we will run a pilot study to evaluate its feasibilities. 10 diets of the patients and caregivers will use this tool at home for 2 weeks. We will learn their experience and the area for improvement through the interviews. So the success of this tool really can benefit multiple stakeholders. Patients can receive a better quality of care, caregiver can experience a reduced burden and stress, and for the healthcare providers, and can be more confident in diagnosing and managing the disease. So it is the missing piece in BrainCheck product. We want to develop a comprehensive digital cognitive health solutions from screening to monitoring, supporting the patient through their entire journey. This project is really a collaborative effort between the researcher and clinician with very diverse background and expertise. It includes the qualitative kind of study expert, Dr. Braid, and from the University of Iowa, and the health AI expert, Dr. Roa from the Oklahoma State University, and the clinical expert, Dr. Brown from the University of Pennsylvania. Thank you. If you have any question, please feel free to reach out.